Yeah, hello everyone. Welcome back to my channel. I still remain Ladipo Taiwolatoi, a clinical anatomist, a medical sonographer. Today we are going to talk on fetal anomaly scan. What brought this topic out is because of what I did yesterday. The case I did, the procedure I did, and an abdominal scan for a pediatric patient, a 3-year-old boy that is diagnosed of posterior urethral valve. What's posterior urethral valve? This is the blockage or obstruction of the posterior urethra, giving us a KO sign descended from the bladder. But before we continue, an information which is very, very important to the mothers, to all mothers in the world. Fetal anomaly scan is not to check sex of the baby. Fetal anomaly scan is not only to check gender for the baby, it's to check the anatomy of the baby from head to toe. That's why we call it anomaly scan. Some part of the world call it fetal anatomy scan, from the head to toe, to check if there is pathology. That's the reason why we are doing the anomaly scan, and it's done between 18 to 22 weeks. Yes, 18 to 22 weeks of the gestation. And what are the indications of doing anomaly scan? It can be for routine screening, it can be for high risk pregnancy factors, yes, some family histories. Yes, you can do it just to check if there is no issue with the anatomy of the baby. For example, if you are scanning the baby and you scan the eye and you didn't see lens, it's possible. Some fetus are blind due to congenital anomaly. You can check for Down syndrome, you can check for cleft syndrome, you can check for many things. You can check for clubfoot, you can check for what is it called, cleft palate, and so on and so forth. So what I can infer from the case I did yesterday is that the client, maybe when the baby was in the utero, fetal anomaly scan was not done, or they did it and they missed it. So please, mothers, fetal anomaly scan is not to check sex alone, not to check gender alone. It's to check the anatomy of the baby, to rule out any pathology. We have more than 250 pathologies. Yes, in fetal anomaly scan, more than 250 in the skull alone. They have more than 100. Even in the whole body, it's like more than 500 pathologies. So please make sure you do a fetal anomaly scan in every pregnancy between 18 to 22 weeks. Supposedly, I don't know if they did it when it was in the utero. They would have detected the posterior urethral valve. So my advice, make sure you do a detailed fetal anomaly scan before you give birth. Make sure you do a detailed fetal anomaly scan before you give birth, so that in the future your children or your child will not curse you. Thank you and God bless. Make sure you like, share, and subscribe to this channel for more vital information. I still remain Ladipotaolatoye, a clinical anatomist and a medical sonographer. Thank you and God bless.